Hi, welcome to the first OSPA webinars. We are excited to provide these to you. We are sad that we couldn't all be together in person as planned for our spring conference, but definitely the safety and health of everyone is what's most important. But as a board, it was really important for us to also provide you some opportunities that you can get the CPD credits that you're used to getting from our organization. We know that's something that we're able to provide 2 times a year, and cutting the spring conference cut that. We also know that there's a lot of need for information right now. So we put together 2 webinars that we think are going to be very informative for the current COVID-19 sessions. However, in order to have our sessions and you watching this be considered for NAS approved CPD credits, you're going to have to do a little bit of legwork because we don't have a system to track who actually watches these all the way through. And so because we don't have that, we had to get a little creative. And so what we did is we created a Google form with code where you're going to fill out code words. So I'm going to share what that Google form looks like. The link to the form is posted in the description and should have also been sent out with the video links that you received, however you got here. So if you don't have the form that I'm talking about, go find it right now, get it opened up, and I'm going to share it with you, what it looks like. Okay, filling out this form should be pretty easy. You have it open here. You're going to, very first thing, fill out your email address, scroll down, click next. Then I would recommend having this open in a window beside the video that you're watching. And as you're watching this video, you're going to see some words come up at the bottom. And every time you see a word pop up, you are just going to submit your answer. So let's say the first word was jump. It's not. We're just saying jump. There's 5 words total throughout the duration of this video. Once you get all 5 in, you're going to click next, and then we need your full name and your district or employer. And once we have that information, we will be able to, well, take that back. Once we have that information and we need the evaluation completed, and once we have those 2 components, we'll be able to email you your NAS CPD certificate. Thank you for participating, and we hope you enjoy our first webinars. Welcome, school psychologists and friends of school psychologists. My name is Sarah Rich. I am the past president of OSPA, and I'm here to talk to you today about frequently asked questions for COVID-19 and being a school psychologist. So we're going to get into it. I'm going to share my screen. Hopefully this is good information for you and where you're at right now. So being a school psychology in the midst of COVID-19, what does that look like? Especially, what does that look like for Oklahoma? By the end of this presentation, we hope that you have the most recently available information regarding school psychology services in Oklahoma. And we're not able to answer every question you're going to have, but this is a starting point. Additionally, a key piece of this presentation is really to help guide you to the resources for further information. So there are lots of different agencies and organizations that are posting a lot of information right now, and it can be really tedious and exhausting to try to find it all. So this presentation is a start to try to summarize what's out there for you and guide you for further updates as they come out. NAS practice model. So we always want to go back to the NAS practice model, and this particular presentation is going to cover a lot of pieces of it. We're going to talk about database decision making, consultation and collaboration, diversity, some of the legal and ethical things that at least what we can try to provide you right now, and then definitely what do those direct and indirect services look like. So this is NAS practice model COVID-19 version. If you have not already heard, school buildings will remain closed and learning will reopen as of April 6th. So they're going to remain closed through April 3rd, beginning Monday, April 6th. The districts must, by April 6th, probably before then, districts must submit and have approved a distance learning plan that details how they are going to provide instruction during this period of time. And that period of time is April 6th through May 8th to 15th is the guidance that school districts have been given from the state board, but they don't necessarily have to follow that guidance. The other really important thing to realize is that the State Board of Education recognizes that this plan is going to look very, very different depending on what district you're in. So schools and families and resources, they're going to vary greatly across our large urban districts versus our rural districts and our suburban districts. So the very first step that schools are going to take is to complete a survey of their capacity and their resources. The OSD is working so hard. I've had a couple different meetings with people from State Department in the last day or two, and they're working so hard trying to get out as many resources as they can, especially the special education department. They're producing as much guidance as they can, knowing that there's still a lot of unknowns out there. So that's this. They are, from what I hear, like so close to having this. The goal is to have guidance out to you on Friday, March 27th, and hopefully that will happen. But in the meantime, if you do have questions, kind of wait. Let them get all those guidance documents out because they're getting inundated with questions right now. And then I would say once those are posted, then read them, see if your questions are answered. And then if they're not, you can start contacting them. They're more than happy to help. It's just they're trying to get out information that everyone can access at one time. I also want to make sure there's a disclaimer. So this information presented in this webinar is as current as 5 p.m. on Thursday, March 26, 2020. But things are changing very rapidly. So we don't know what changes may develop over the next days and weeks. Therefore, please verify any information that we're presenting in this presentation with your school district, direct supervisor, and also please check with OSDE on those guidance documents. And then if anything we say contradicts those, please go with what you're getting from those official sources or the most up-to-date information that you're getting. Additionally, we're not lawyers or representatives of governing agencies, so none of this information we present should be intended to replace advice or direction received from an official or legal channel. And so basically, no one's done COVID-19 before. We're all doing it. We're all trying to figure it out. This is our best understanding of the guidance that we've received so far. All right, so let's dig into these frequently asked questions and what a school psychologist is to do in a time like this. First, let's get into timelines. I know that's probably number one pressing question of, well, what do I do with these evaluations that are due? A question you guys are all probably wondering is, after April 6th, is the 45-day timeline reactivated for those initial evaluations? Yes. As of right now, the guidance from OSDE and the U.S. Department of Education indicates that all timelines are still applicable and should be followed. Oklahoma has established initial evaluations must be completed within 45 school days. Hope you guys knew that. Since schools were officially closed from March 23rd through April 3rd, those are not school days. So those do not count towards the 45 school day timeline. If you have not already done this, someone needs to go into your district's ed plan and mark those 2 weeks, March 23rd through April 3rd, as non-school days, just like you marked spring break as non-school days. So those aren't going to show up in Ed Plan. Starting April 6th, then your your time frame opens back up. Okay, so time frame opens back up. Some information that I don't have on the slides here, but I think I need to address because it's come up within the last few hours, is a little bit of confusion with what happened with the state board decisions yesterday and how that affects this 45-day timeline. So the state board basically said that schools can stop counting attendance days, but they're still counting instructional days. So even though the calendar has stopped on attendance, it has not stopped on instructional days. And that's my best understanding of the process and talking to people, as well as looking up information from the Oklahoma School Boards Association. So I would recommend continuing looking at those resources. The Oklahoma State School Board Association, they have a great FAQ list. But it was very clear in the documents posted from the board meeting yesterday, as well as reading the FAQs there, that instruction should still be occurring, and these are instructional days, and our 45-day timelines based off of those instructional days. Okay. However, this does not mean that you are supposed to conduct live in-person assessments during this time. So, and I will get to what that means in a little bit later. We'll discuss that in some of the other FAQs, but I'm not saying you have to finish like a WJ. I'm saying that your timeline's still open. Okay. Here's one reference point for this. Like I mentioned, the other reference points of what we're gathering is based off of what came out yesterday, or some of the state board association FAQs, as well as just reading the amendments and waivers that were passed at the state board meeting. On March 17th, 2020, there was a FAQ section for the whole State Department of Education, and there was a special education piece, and it specifically said that initial evaluations must be completed within 45 school days of receiving initial parent consent. If the school calendar is changed, then your due date changes. And what that's referring to is, like I said, you have to close out an Ed Plan those 2 weeks. But once instruction's given, your timeline is back open. And that is my, again, best understanding of where we're at right now. So let's talk about reevaluations. So do reevaluation timelines still apply for those due during either that school closure period or this distance learning period? Yes. Again, as of recording this video, there has not been any waiver issued by the federal government to alter timelines for IEPs and evaluations. And the Oklahoma's Department of Education does not have that power. It is a federal decision. So therefore, the original reevaluation due dates will not change based on the current situation. As we just discussed with the initial evaluations, this does not mean you need to conduct a live in-person assessment. Schools have always had the flexibility and option to decide that reevaluations can be completed without additional data. And as always, schools will need to review existing data and determine the needs of the child. The determination of needing additional data or not should not be based on the current situation. So this determining that I'm going to do a reevaluation without data, you're not going to choose that just because we're in COVID-19. You're going to do it based on the best needs of that child. So if additional data is needed, then what I'm going to recommend, and I'm putting myself on here because I'm not sure, this is just what makes most sense to me, I recommend marking the need for additional data on that review of existing on the REDS form, holding a MEGS virtually to officially close out the reevaluation, and then the team will need to document very clearly that additional data is needed for this child, but not possible at this time due to safety concerns regarding in-person assessments during the COVID-19 outbreak. So then the team is recommending to close the reevaluation to meet that deadline, but then to open a new reevaluation when data are able to be collected in a safe and valid context. Okay. Again, that is my interpretation and understanding. What I just said there has not been clearly documented anywhere, except for the fact that you still have to do the reevaluations, and that makes the most sense to me of how to do those reevaluations when I need more data, but I physically can't collect the data. The one piece of written documentation that we have is from that same document that says reevaluations must be conducted every 3 years. A change in school calendar will not affect or extend the due dates for a reevaluation, but this does not prevent a reevaluation from being conducted prior to the 3-year date and therefore adjusting a new date. So that would have been more applicable if we were coming back into school or if we knew there was a school closure, but we didn't know that was coming. So, for children transitioning from Sooner Start, do they still need to have eligibility determination on or before their 3rd birthday? Yes. Seeing a theme here? Again, at this time, the timelines have not changed for any individuals or evaluations. So if they are currently receiving Sooner Start services and they will turn 3 on or before we get back in school, and whenever that is, then you need to go ahead and complete that process. Again, this does not mean that you are supposed to conduct a live in-person assessment. The school-based team should be working with that Sooner Start team and determine what decisions can be made on the available data, and if we need to maybe document need for assessment later on once it's able to be conducted. Again, from that resource document that children with disabilities transitioning from Sooner Start and determined eligible for services must still be in place on or before their 3rd birthday. All right, so those are the 3 main timeline questions that I think probably are going through your head of what do I do with these. Let's talk about what it means to actually complete an assessment here in a virtual world that we're all now living in. Can we conduct assessments during this period of closure, so like right now, or the distance learning plan time after April 6th till whenever your school officially stops for the year? It depends. So the OSD has clearly indicated they do not want district staff to unnecessarily increase the risk to children and employees with in-person exposure. So our understanding is that this means meetings and testings that require face-to-face should not occur. So priority right now is to maintain that safety. However, there are some assessments available that are designed and intended to be used at a distance. These are primarily things like rating forms. So sending a BASC or sending a Vineland or a Connors, conducting a Vineland interview over the phone, those type of things. You wouldn't necessarily need to have face-to-face contact to do those. These may be completed through distance methods. That doesn't mean you necessarily have to. So if you do have an evaluation and it's only going to require some rating forms and you think you can get that back and it's going to be valid information, then you might consider going ahead and collecting and completely closing out that assessment. This is one piece of guidance I found from the Office of Civil Rights, U.S. Department of Education, for a letter dated March 16th, 2020, that says, if an evaluation of a student with a disability requires face-to-face assessment or observation, the evaluation would need to be delayed until school reopens. Evaluations and reevaluations that do not require face-to-face assessments or observations may take place while schools are closed, as long as the student's parents or legal guardians consent. And I know we already have consent to do testing, assuming this situation. I don't think you're going to open up any new assessments during this time. But I would make sure that parents are okay and understand that we're doing a virtual version of this, and be very clear on how it would have been conducted if school was live versus school being distant. I really, really strongly consider if you're going to conduct any actual assessments during this period, though. So there are many creative ways to conduct assessments using virtual and distance means. But I think we need to stop and really consider this process before we dive into it. Really, there are two main things that I should be at the forefront. One, do we have the competence to do this? None of us have ever been in this situation. Most of us probably don't provide virtual services on a day-to-day basis. And also, what's best for students? Really think, do students actually need an assessment right now? What will happen if we wait on the assessment till school reopens? Is there any detriment to that student if we just decide we're not going to do the assessment right now and we're going to close everything out procedurally? So as far as your competence, think about, have you received training to conduct these assessments? And when I say training, I mean actual supervised experience through a virtual means. You also need to think about the platforms and the way that they're designed to implement assessments. So simply holding a WJ stimulus book up to a camera through FaceTime and asking the child to point would not be a designated appropriate platform for that. There are companies who have platforms for online assessments, such as maybe Pearson's Q Interactive, but even that is set up for the WISC administered in the room with the child, and the child has an iPad and the administrator has an iPad. It wasn't necessarily designed and normed with administrator in one completely separate location and the child in their home. And also, just technically, I think a lot of those things require actually the same Wi-Fi or Bluetooth service to even work. So thinking about the technology piece there. Also think about how much support will that person need to complete it. So think about the task you're going to be asking those children to perform. What kind of technology do they need to have access? Does every child that needs an assessment have that same access to technology? There's also the concern for confidentiality. You don't know who's in the room when you're giving that assessment to that child. Do they need someone in the room helping them and they can't? Also test security if you're now publishing things through an open network. So a lot of concerns there. And finally, I really want you to consider, what's the validity of doing this? When we do an assessment, we should be asking, what is the purpose of collecting this data and how will it apply to my decision making and my recommendations for this child? This right now is a high anxiety situation. Across the world, people are experiencing anxiety, and I don't think there's anyone really in normal mode. So it's unlikely that any data you collect at this moment will truly be representative of the student's functioning within the typical classroom environment. NASP has provided some guidance, and that's the things I talked about came from that. So just considering, they also have a webinar on virtual service delivery, and I really encourage you after you're finished with this webinar to watch Dr. Ollinger's, who's going to point you to all the amazing NASP resources that have been published recently. All right, so do we need to complete assessments that were already started before the closure? So what if you were just halfway done with your evaluation? What do? You need to, yes, you need to complete them, but that doesn't necessarily mean new assessments. So again, you're going to hear a theme from me, but at this time, the federal guidelines still stand regarding completing assessments. So all open consents need to be completed. However, you have several options there. If you have sufficient data to make a determination, then it's recommended that you go ahead and complete that MEGS as you would normally, but through a virtual meeting process. If you did not complete all the intended assessments, but you still have enough data to make a team decision regarding eligibility, then document what was not completed and the reasons the team determined the decision could go ahead and move forward. So for example, if you were in the middle of doing a reevaluation and the one thing left was a standardized achievement test, but you're able to determine ongoing eligibility based on all the other information and you can use some existing academic data, then the team might decide, you know what, we have enough to make our decision. Let's go ahead and make that decision, and we'll document on our written notice that we didn't complete all the fully intended battery, all those things checked that said we were going to complete, but we did feel like we could move forward with the available information that we had. Document it. Or the team could decide that we need to close this evaluation and document a plan for reopening the evaluation once face-to-face assessments can be completed. So what your team would do then is, again, hold the meetings, officially close this evaluation, but then clearly document your plan for what you're going to do to complete this once we're back into live schooling and you are able to have face-to-face contact with that child. Either way, my understanding is that the MEG still needs to occur and be completed, and the team needs to just document what decisions were made and why they made those decisions. And this is that same one that I showed you earlier, but just talking about the fact that you can close out those evaluations. So we keep talking about doing MEGs and all these things. Well, so meetings, we do a lot of meetings. How are we going to do those right now? So do we conduct meetings in person if parents request it? So you call a parent, they're like, hey, I really need an in-person meeting. Can we go ahead and have that meeting? No. It has been very clear from the board meeting on Wednesday and all the previous correspondence from Superintendent Hoffmeister that safety of students, their families, educators is the primary concern. So we're trying to limit exposure. So during this time right here, right now, you can't have face-to-face meetings. However, you can and should be trying to meet virtually or through a conference call with all of your team members there. So you're going to hear that term virtual a lot, but like I said at the very beginning, virtual is going to look very different depending on what school you're in, what that school's resources are, what the parents' resources are. So the school should be taking any means possible to meet with parents, and part of what the IEP team probably first step that needs to occur is an assessment of how can we get a hold of our parents? Are our parents able to meet through a online platform where we can all be, have a webcam? Are they able to do a phone call? Is that too much for them? So are we even able to get a hold of our parents? So again, what we're hearing is you need to call, you need to try to get a hold of the parents, explain to them what's going on, give them their options and figure out what they prefer, and then set up that process for those future meetings or for the meeting. If you can't get a hold of parents, parents are refusing to participate through any of the virtual meetings, or just because of the trickiness of the situation. We all have those tricky cases, and you feel like it would be in the best interest of that child to wait till you can have a face-to-face meeting. Then you need to document that. And again, document, document, document. Make sure all your attempts to contact parents are documented. Make sure that all their responses are documented, and any team decisions are clearly documented. And this is one of the first guidance documents that the OSDE Special Education Department was able to get together, which is how to hold a virtual meeting. It's a really nice step-by-step guide of what you need to do to hold a virtual meeting. So if you have not seen this yet, I recommend that you find it. I will, at the very end of this presentation, I'm going to point you to the direction of some of those places to find them. They do list some examples of virtual meeting platforms. You just need to really make sure that you do your due diligence that platform is FERPA compliant. And I would even then go an extra step, even if it says, yes, it's FERPA compliant, like Zoom that we're using right now to record this is FERPA compliant. However, there's been recent issues of people apparently popping up into Zoom meetings who weren't ever supposed to be in that Zoom meeting. I'm guessing some unintentional, but it sounds like some intentional as well. So I would recommend using a password for any meeting that you have, and finding a platform that's not only FERPA compliant, but that allows you to use that password, so you can make sure that only the people that need to be in that meeting are in that meeting. And there's a lot of guidance from the U.S. Department of Education on FERPA as well that's out there, and what all that involves. But that's something you're going to have to do your research on and talk to other people, but try to make sure that no one can accidentally get into that meeting. Another piece of it, though, is not just the technology, but who's around at that family's home, and making sure that they're okay with the things that are being discussed, in the format they're being discussed, in the environment they're being discussed. So if that family has grandma and granddad living in their house, and grandma and granddad can't leave because we're all stuck in our houses right now, but they don't want grandma and granddad to know about the most recent situation with that child, then you need to make sure with the parents, that might be a reason why they can't have a virtual meeting, because they can't maintain the FERPA compliance that they want to have on that level. So a lot to think about there, but just really trying to make sure that you're doing, again, what's best for the students and the families that we're working with. Some more information from the Department of Education. They released this as far as conducting required meetings under IDEA, and the fact that it should be conducted through those virtual meetings. So very clearly you need to conduct them. The other thing is making sure that all your team members are required to be there. And you don't get an excuse for this. We need to be there. And if parents can't attend by phone or virtual due to accessibility issues, the district needs to document those reasonable attempts. All right, so moving on to what about our kids with the social, emotional, and behavioral supports? I know as school psychologists, we're doing a lot more than just testing out there. So what do we do with these children? Do I need to complete an FBA or a behavior plan that was already started prior to schools closing? Yes. From a procedural standpoint, it's an open evaluation. It needs to be completed. But I would hesitate and really consider what that looks like. So if you already have collected data and you've made your determination, your hypothesis, you might go ahead, close that out and write it up, but you also need to consider that any data that was already collected may not be applicable to the current environment. So we all know home and school look very different. So recommending or saying this is the function of their behavior and the behavior plan needs to be written up for the home may not be the best approach because we don't know what the home environment looks like. We don't know what that child's doing in that home. The other consideration is if you're thinking, well, I'll just write up the FBA that we have done and then a behavior plan for next year, you also need to think about the fact that school years differ from behaviors differ from school year to school year. So there's going to be a different level of need based on the available supports for this year versus home. So really what I'm saying is procedurally, I would recommend closing it up. As far as how much information and what you actually provide at this point, I think you summarize whatever you have. If you don't have anything, then you document. If we didn't get anything done, we will reopen if there is a need for an FBA and a behavior plan when schools are open. So I think it's important to really, again, consider the context, make decisions based off the data that you have and what's best for students, and document, document, document. I would like to say, and I am telling you all of this because of this resource. Currently, we have not received any guidance specifically related to FBAs and behavior intervention plans. However, I think as practitioners, we have guidelines for completing all assessments, so we know if something's open, we need to close it. There's the documentation from NASP regarding virtual service delivery. Again, I think you need to look at that in the context of it, if so that could apply for it. And then there's our ethical guidelines of how are the things that we're recommending really applicable to the setting that our students are in right now. Guidelines from NASP, APA, and also like the board of certified behavior analyst. So all of those are going to be applicable, and we're trying to do what's, again, best for our kids with the data that we have. What about our kids actually that are needing those services like teletherapy, parent training? Instead of doing a behavior intervention plan, can we do parent training, or can we help provide social emotional supports through this distance learning plan? The answer is maybe. Again, information is really limited right now on what this looks like and what service delivery is going to look like. And again, it's going to vary considerably from district to district. So FAPE is still applicable, as well as IDEA services. If a student was receiving these type of services in the school building, then the team's going to have to determine what's a comparable level of services that we can provide in the home setting, but also comparable in the terms that our general education students were getting 6 hours of instruction. They're not getting 6 hours of instruction at home. So everyone's method and comparable services are changing. All services may not be feasible within the home setting. So even though they were getting something in school, it might just literally not be feasible and so we need to consider that. Also, all services might not be needed, especially things like behavior plans. So, and just because a child needs a behavior plan doesn't necessarily mean they need one at home. Also saying they might need one at home, but they don't need one at school. That's another story. So really, this is a conversation that IEP teams are going to need to have once their districts come up with their learning plan and how they're supporting students with special education services. And also, again, I hope we get more guidance from that. The one thing that I did see is from the March 21st meeting from, again, the Office of Civil Rights, or the March 21st letter, said that schools may not be able to provide all services in the same manner that they are typically provided, which I think is really helpful to know. Like, they're not expecting you to completely replicate what the child was having in school. And many disability-related modifications services may be provided online. So, but we can provide things online if it's available, feasible, needed. And it's also important to allow that there's some flexibility in determining how to meet those students' needs with disabilities. So again, we're all trying to do our best with the information we have. All right, so that was only a few FAQs, but a lot of information. I want you guys to know the resources that are out there so that you can stay up to date. So I'm going to share this slide with you, but then we are also going to have all of these links in the description section of this video on YouTube, as well as posted on our website. But I just wanted to walk them through and make sure you guys know kind of where's information going, because it's going everywhere. So our department, Oklahoma Department of Education, the Special Education Department, they do have their website. However, what I have found the most immediate way to get information from them is to follow them on Facebook. So if you search for Oklahoma Department of Education Special Education, it'll come up. Their little icon says IDEA on it, or this is their user profile. You can search for @OSDE Special Education Services on Facebook. There is also a listserv. If you do not get emails from the Special Education Department, then you need to sign up for that. They have the link to sign up on their Facebook page, but we'll also post that link. As far as receiving more general, not necessarily special education, but more general information from the Department of Education, you can look on their website. They post everything that they send out gets posted on their front page. They also will put things out through Facebook and through Twitter. And so that's how you get things kind of immediately out there. There are also a lot of different listservs for different populations, and you can go on their website and sign up for those. The Oklahoma State School Boards Association has a really nice COVID-19 FAQ. It is for school boards, so it's asking very procedural questions, but some of those questions about, like, are we in school or not in school? Do we count attendance, not count attendance? Is this an instructional day versus not an instructional day? Those questions are getting answered on this website. Also, as I said throughout this presentation, the local and state level authorities cannot waive IDEA timelines. That is a federal decision. And so we're really waiting to hear from the federal government on what they're going to do. And they did just have released some funds for education today that got passed. And so things are happening quickly. So I would recommend following, again, Twitter seems to be where they post most of their information. There's also a dedicated COVID-19 site that anything that goes out from any department or any section within the Department of Education is getting posted there. So hopefully as soon as we get more guidance on special education, assuming we get it, it will get posted there. NAS is working their tails off for us right now. They are putting out resource after resource for what to do. And again, Twitter and Facebook, they post when they have updates. And then they also have a fully dedicated COVID-19 website that I really encourage you guys to go to. All the little screenshots from documents that I had in here, we're going to post those in the description of this video as well. We're going to open up our own dedicated page for these documents on our website. We don't have that up yet, but it will hopefully be up very soon, and maybe by the time you're watching this. So you will be able to see the documents, and we're going to try to pull the ones and highlight the things that are applicable to school psychologists, because the school psychology information is mixed in with all this other stuff. But you're also going to have to kind of keep your eyes and ears open as well. But we'll try to also be posting on our social media when new documents that are useful come up as well. In the link, again, description, there is an evaluation. We ask that you please complete this. One, if you want continuing CPD credits that are NASP approved, you have to complete the evaluation. So if you want that, you need to complete it, as well as the little code word thing that you hopefully have been doing throughout this presentation. As well, this is our first attempt at webinars, and we're kind of forced to go into it, but we want to know how it works out for you and what you thought about the process. So please give us that information. And finally, I just wanted to take a second to breathe. Guys, this is all going to be okay. None of us have ever done this before. We're all in it together. Usually in a crisis situation, you have other people outside that can help you, but we're all in it right now. And life is new, life is different. I know a lot of you are trying to figure out how to be a mom, a homeschool teacher, as well as a school psychologist or other educational professor simultaneously. Like, not even, okay, I can do this job from this time to this time, this time to this time. It's a simultaneous thing. And it's hard, and no one has the answer, and everyone is just trying to do the best that they can right now. So if you feel overwhelmed, I really encourage you to take a break, breathe, realize it's going to be okay. We're all going to get through this, step by step. It's okay to not be okay right now, and that's okay. If you need some resources, stop my screen share there. Just wanted to say, if you need resources, whether it's, hey, I'm getting conflicting information, can you help me figure this out? Let OSPA know. We want to help you guys during this time. If you're feeling overwhelmed and you're just like, I don't know what I'm supposed to be doing, let us know. Let us know how we can support you. Give us whatever information. We're here for you. Even if it's like tech tools or whatever it is, reach out to us. Our board is all doing this together too, but we want to be here for you. We want to support you the best that we can as an organization. And so I really encourage you to use us as a resource. And also, if you're thinking it or you're having this issue, probably other people are too. And so that can help prompt us to address it and figure out, either direct you to a resource or develop a resource. All right. Please complete your evaluation. If you did the code words, make sure that's submitted, and take a break. Thanks, guys. Bye.